normal. So, what's the problem? I mean, because everything looks normal. And that's what's frustrating to parents, because they do all these tests, but clearly their child's behavior is not the way it's supposed to be. And so we've been able to show that there's a functional imbalance in the brain that occurs during development that causes what we call a functional disconnection between networks. So as the brain is developing and emerging, it develops in a specific way where the right brain, the right hemisphere develops in the first 2 to 3 years, and then the left brain takes the lead. And all during that time, the idea is that the brain is specializing and becoming differentiated, and the right and left brain are doing different things, which is very important. But the brain also has to become more and more integrated. It has to talk and flow. There needs to be flow of information at all times, and the brain needs to be flexible. What we've been able to show, and other people have showed this too, is that there's this breakdown in the communication where there's not damage. It's not, a wire being broken. It's just they're processing information at different speeds because of different maturational levels, so that the brain can't communicate, so that certain areas and certain networks are overly active and are producing symptoms like tics or OCD or stimming behavior or anger or too much inflammation. And other networks on the other side of the brain are underdeveloped or immature. And so there may be lack of eye contact or nonverbal communication, or not feeling their body, or not wanting to form relationships, or really reading other situations, and, not understanding certain concepts. So there's symptoms are a combination of areas of the brain that are maybe too strong or overactive, and other areas that are underactive and underdeveloped. And that combination, whether it's left or right, or what networks on the left and the right, is really what explains almost every mental health issue in children and adults. And we know that almost all adult mental health issues start in childhood.